So the main thing that I did with Meta was actually training workshops. So I was teaching them on how to use the tools we had been using. I set them some homework, and even though I thought they wouldn't finish it because they had some kind of they have language barrier for one. Plus, they're not familiar with the tools and not familiar with the software. They actually managed to finish the homework and go above and beyond what I had asked for. They were very eager to learn and to show that they can do much more than I had expected them to do.
Yep.
I think one memorable moment has been when I was outfield and we were meeting with two boys who's part of a family. And these two boys were born to Thai father, and they did not have Thai citizenship, and they were stateless. And as a result, they could not access Thai public schools or healthcare. But through a project that we were working with called that helped with digital identity systems for about 1,700 households. These two boys were now on their way to getting Thai citizenship, which gives them access to all the privileges of citizenship. So I thought that particular moment was moving for me because it really showed me that sometimes little changes like really helping people access legal help through technology can change a family's trajectory and the opportunities they have access to.
The first moment is sharing a mookata meal by the local lake with the team from Maytao Clinic. I think it was really special just to share that moment with them, to hear their stories. I felt we became friends by the end of it. And it really helped me to appreciate the community and the people that we were serving. And how they themselves, they bring their own challenges, their struggles. They have been persevering at this effort to serve their community by providing healthcare for so many years. And it really helped me to bring home, why we're doing this. Yeah, so that's a moment that will stay with me. The other one is a moment that I wasn't personally present for, but I saw the photos of it. I heard the stories from the people who were there. How the team at Maytao, they came together and on their own accord, spent extra time looking at the screens that they were designing for the second pilot. And I think that shows a hunger to learn, to really understand the system, to make it their own, to pick up the necessary skills. Yeah, that was very encouraging because it really goes to show that the local team was taking ownership of this project.
A moment that stuck with me was early on in the project where we conducted a systems training when we were rolling out the platform for the first time. It was actually a few days after when I sat down next to one of the staff on the health information systems team. She had shown me a data dashboard that she built by herself using a different low-code tool. And I think we just had quite a good experience building together. And for me, that was meaningful because I was really impressed by how quickly our partners were adopting not just the tools that we bring, but also the thinking around how do we solve problems using what we have, right? And being open to exploring various technologies. And for me, that was very heartening to see.
I think one moment that stayed with me was after working on the project for I think 3 or 4 months. It has always been like online. Everything has always been like remote. So I think when we finally went to Maytao Clinic in person, I think that was very impactful for me because I think I finally got to see what we're working on and why we're working on these issues. And yeah, and then I talked to some of the people at the clinic and they told me about their experience with our project and a lot of positive feedback. And it was very nice to hear in person about like what else we can do to help them. And yeah, things like that.
I got a lot of moments, but to pick one, it was during the hackathon with Equitech engineers back in 2024, before the first pilot of BHR in Meta. So I was not involved in the project. I was just there to observe. Invited by Hui actually, and because I was already volunteering for DevGens, and yeah, like it's fascinating to see how. Sorry, I accidentally muted. Okay, so how with the right tool, the building things could be quite fast and convenient, especially for clinics like non-profit organization like MetaClinic, because they cannot pay huge check for conventional systems, hierarchical systems. So it's quite nice to see how technology can fill that gap. So yeah, it's wonderful.
In a very early stage of actually, this is just maybe about a month ago, as we were trying to implement Medibot with one partner organization, Timor-Leste. We are trying to teach these doctors who have been practicing in Timor how to make use of the bot, and required them to enter a simple passphrase. And so this was shared to them with through WhatsApp. And then for the next about 3 days, I spent correcting multiple people for their passwords because they weren't entering it in the right case, or with wrong spaces, or with hyphens, etc. And it felt a lot like how it would be when I'm helping my mom to sign into something on the internet. So the fact of the matter is that a lot of these healthcare professionals in Timor don't have a lot of IT literacy or data literacy, or some of the norms of making use of new apps, just like what a passphrase would be and how it's case sensitive. So the fact that they don't have all of this prior knowledge means that implementing a bot or a technology solution in a place like Timor requires a lot more help, a lot more hand-holding, a lot more support than it would in a place like Singapore. And so one of the things that I found interesting in that experience is that here you can send somebody a QR code, send somebody a password and a set of instructions, and bam, they'd be able to use the app. But in Timor, it's often a lot of sitting with them, helping them type and move things back and forth. But once they get it, that's when they're able to reap the value of making use of the bot. Okay, so that's one, I guess, incident that stays with me. Another one that stays with me is that this is about a year ago, when I was working with a team that was providing HIV care to about a third of all of the HIV patients in Timor-Leste. And among the people with HIV, there are these women who are HIV positive and who become pregnant. Now, for those guys, it's especially important for them to be on the right HIV treatment throughout their pregnancy, because if that happens, the chance of their baby being born with HIV is nearly zero. However, if they're not on the right HIV drugs, then during the pregnancy, they can have a high HIV level, and then the kids can be born with HIV. Now, in this case, there was an HIV positive pregnant woman that they were taking care of. And she was on her drugs. She was following up, and then she disappeared from her care. She just didn't show up for some appointments. And the team, due to lapses in their operational capability, wasn't able to track her down and then get her back into care before her delivery. And something like a week or so before her delivery, she appeared on her radar again. And then when we tested her blood, her HIV level was extremely high. And so we put her back on drugs, monitored her very, very carefully, watched her all the way to delivery. And she delivered, and they were twins. And both of them were HIV positive.
Oh, man.
Which is terrible, because it is a completely preventable tragedy. That broke our heart, because that should not have happened. And this is a team of extremely competent, very capable, very compassionate healthcare providers. They're really good at providing care to the patient in front of them. But when the patient leaves, and then the administrative processes kick in of following up their appointments, ensuring return, ensuring blood tests, etc. Those are the kind of administrative processes that are really, really hard to get right when you're dealing with a very large number of patients.
Yeah.
And this is the team that over about 4 years increased from about 50 patients to about 500 plus. And so they were struggling to get their administration and operations right. And as a result, this one lapse resulted in this pair of twins that have just been born last year, and they're going to spend their lifetime being managed for HIV. And that was one of the incidents last year that, for me, was a very clear moment to say, we must put in place something so that this doesn't happen. And clearly, technology solutions are what do that job, because the administration of a large number of appointments and coordinating patient care, that's the kind of quite rule-based tasks, very administratively heavy tasks, very, very mafan tasks that nobody wants to do. But if done right and can be done reliably, done fast and securely by an automated system, that would free up our healthcare providers to focus on the individual patient care, the kind of things that only they can do, which a computer can't do. And so that was another quite important moment for us. Let me think. Another important moment for me in terms of technology in Timor was, tuberculosis. So many people in Timor get diagnosed with tuberculosis, and when somebody gets tuberculosis or TB, how they're supposed to be managed is, of course, you treat the person who's got TB, but also you need to go to their home and check all of the people around them. Some of them will have symptoms, some of them won't, but even if they don't have symptoms, they may actually have the TB germ that's growing in them. So what needs to happen is those people need to be checked, and some of them need to be given a medicine to prevent TB, and some of them need to be given a medication to treat TB. And you've got to get this right, because if you give the TB prevention to the person who's actually got TB, then the TB germs become resistant to it. And so there needs to be follow-up, decision making, and a lot of tasks that happen distributed over time and over people. Meaning that one person does this, a different person does the screening, a different person gives a prescription, a different person follow up. So it's exactly the type of human processes that fail all the time when it's done manually and not coordinated. And that process, we found in 2022, 2021, the median time taken for somebody to be diagnosed and then for their entire family to either get TB treatment or get TB prevention was about 3 months, because of all of the lag from various things. But at the time, we implemented some digital solutions in order to speed up that process of finding that person who's got TB, doing contact tracing around them, screening people, and then starting them on the appropriate medicine. And we managed to cut that down from about 3 months down to about 2 weeks. And so that was a tremendous improvement in the speed at which we could get things done. But that also meant that we were more reliably stopping people from getting TB and treating people who had TB so that it wouldn't get worse.